Botox is the brand name for what is otherwise known as botulinum neurotoxin. What is botulinum neurotoxin?
So he's going to go into details of what Botox is, but Botox is used commonly for aesthetic purposes, of course, on the face and reducing wrinkles. It helps to soften, it paralyzes the muscle, it helps to soften wrinkles on your face. Whether people are using this increasingly and more common for hair growth on the scalp, not too many people are. Now, I think more research needs to be done to see whether or not Botox really is beneficial in helping to regrow hair, but not too many people are using Botox frequently for hair growth.
Well, botulinum neurotoxin, sometimes just called botulinum for short, is a toxin that's a bacterial toxin that serves to cut the protein that leads to synaptic vesicle release. What in the world did I just say? Well, when your nerve cells communicate with one another, they do that by way of electricity, but the electricity within those nerve cells, those neurons, triggers the release of chemicals from neurons into the synapse, the little gap between neurons. And the release of those chemicals allows the next neuron to be chemically active, or in some cases, it will suppress the electrical activity of that next neuron. Botulinum neurotoxin serves to cut a protein present in neurons so that neurons cannot release the chemicals that cause other neurons to be active. So this actually is pretty serious. If you were to get botulinum neurotoxin injected into your muscle, you would be paralyzed because the nerves that control contraction of the muscles would not be able to control the release of that chemical onto the muscle, which makes it contract. Now, botulinum neurotoxin is commonly used in what's called Botox. Botox is something most people are familiar with because people get it injected in and around their wrinkles, because many wrinkles are triggered by not just loss of tensile strength in the skin, but rather the nerves around the skin and in the skin are hypercontracted, which causes wrinkles. So for instance, I have crow's feet. I like to think that's because I've laughed a lot and smiled a lot, and it's probably also because I've squinted a lot in my lifetime. I have crow's feet because the nerves there have pinched the skin on either side of my eyes, and that's given me little creases there that are sometimes referred to as crow's feet. Botox injections can be applied to the scalp in order to relieve tension of the scalp. And in hearing that, it should be obvious why Botox is being used to try and offset hair loss. It's decreasing the squinting, if you will, or the tensile nature of the scalp skin so that more blood flow can arrive at that stem cell follicle area. So Botox treatment to the scalp is actually becoming pretty common. There are a couple requirements with this Botox treatment. First of all, it has to be done by somebody who's really skilled. There are numerous images online and websites online of so-called Botox fails, where people have gotten too much Botox, or the injections have been done too deep, or not at the correct locations on people's face or scalp, and it can give them droopy scalp or droopy eyes. All sorts of cosmetic nightmares can occur with Botox. The second thing to understand is that Botox does eventually wear off. That botulinum neurotoxin doesn't stick around forever. And provided it's done correctly at the correct dosages, it doesn't actually kill the neurons that cause that tension of the skin. So Botox injections have to be done repeatedly. The efficacy of Botox for offsetting hair loss is not clear. There aren't a lot of large-scale clinical studies on this just yet, but it does seem to be at least one reasonably safe alternative.
Yeah, so Botox may be reasonably safe to do it. I don't think that there would be a lot of complications to try it. It's true that there are not a lot of studies to back it up. Whether or not it relieves tension, increases blood flow, and that increased blood flow helps to increase the anagen of the growth phase of the hair cycle, is yet to really be shown conclusively. So I don't think most practices or clinics are actually giving Botox. It's also an expensive treatment. It does have to be done frequently. It wears off every 4 to 5 months, so you would have to repeat it. And it's not clear exactly how much Botox or how many units would need to be injected. So it may be an option. It's something that you could try. You'd have a discussion with your patient regarding the pros, the cons, the risks involved. And if they want to try it, you could try it. But just remember, it takes 6 months to a year to see results from any treatment. So you may have to do 2 to 3 Botox sessions before you may see a result from that. Now, people are using Botox in the scalp for other reasons. Now, migraines, Botox is being used to treat migraines that people have, and it does look to be useful for that. Whether people with migraines are seeing more hair growth, I haven't seen anything about that. Also, people are now using Botox in the scalp to reduce sweating, so it decreases the activity of the sweat glands in your scalp. So people that style their hair, do their hair treatments, and they want to preserve a hair straightening treatment, they are getting Botox in their scalp. Some, it's becoming more and more popular to preserve that hairstyle, reduce the sweating. They can go to the gym and they don't have to worry about their hair. So that actually is happening. And it's very interesting. We'll see how popular that becomes.
So by now, I think it will be abundantly clear why inhibiting 5-alpha reductase and thereby reducing DHT should increase hair growth because of the negative impact that DHT has on the hair follicle. The major player in this whole story around inhibiting 5-alpha reductase and reducing DHT to maintain or increase hair growth is going to be finasteride and its close cousin dutasteride. Finasteride is effective in reducing DHT because of its actions in reducing the type 2 isoenzyme or isoform of 5-alpha reductase. It turns out there's 3 different isoforms, or what are sometimes called isoenzymes, of 5-alpha reductase. This is getting pretty far down in the weeds. What I think most of you just need to know is that finasteride reduces DHT. That's the net product of finasteride. And in doing so, it can increase hair count by as much as 20%. Pretty remarkable if you think about it. In addition, finasteride treatment done properly, which we'll define in a moment, can reduce hair loss in 90% of all people that take it. So that is, near staggering.
And that's accurate. Finasteride is very effective. So it does inhibit the conversion of testosterone to DHT by blocking the type 2 5-alpha reductase enzyme. So there's less DHT or dihydrotestosterone. There's receptors for DHT in your hair follicles that cause miniaturization or thinning and eventually hair loss. But finasteride is a very effective medical treatment. And there are some potential risks or side effects that do need to be discussed with your physician before you start taking it, however.
Aggravating. There aren't many pharmaceuticals out there that have that kind of efficacy. Really dramatic. And in addition, it's known to increase hair thickness by about 20 to 30% overall. So not just create new growth of hairs and thicker hairs, but whatever hair you do happen to have on your head, it can further thicken those.
Yeah, so I find that it doesn't grow new hair that you don't have. So someone who's bald taking finasteride is not going to all of a sudden grow new hair, but it can thicken the hair you do have. So if you have thinning hair, and as he said, it can thicken it up maybe 30%, and that's significant. So you have the same numbers of hair, the density is the same, the volume is increased, right? So there's more volume of hair per area on your scalp. So it looks fuller, there's less scalp show, and it can really make a significant difference in that sense.
So the finasteride story is one, I think, of general success. It really seems to improve hair growth and help you hold on to the hair that you have. The issue with finasteride is twofold. First of all, it is known to have some pretty significant side effects if it's not dosed properly and in particular populations of people. And this is because there is a wide variation in the amount of the different isoenzymes that people make. So this is why I brought up the isoenzymes earlier. Some people make more of isoenzyme 1 and 3. Some people make more of isoenzyme 2 and 3, and every variation thereof. So when people take finasteride, some people are very strong responders, and they achieve really effective hair regrowth and maintenance of hair. Other people, less effective, although still pretty impressive, but the catalog of side effects that people experience at a given dose varies widely. So there's a lot of trial and error that has to take place. I also should point out that finasteride comes in 2 major forms. There's an oral form and there's a topical form. So this is not unlike our discussion of minoxidil earlier. Topical finasteride is typically taken in 1% solution or ointment and rubbed into the head. Sometimes it's now also incorporated into shampoos, but typically it's put into a solution that people rub into their head. And it is thought that the 1% solutions are equivalent to 1 milligram of systemic finasteride. Now, we need to take a step back and ask, why was finasteride developed in the first place? Well, finasteride, as a fairly potent 5-alpha reductase inhibitor, it's great at lowering DHT. It was developed for treatment of prostate enlargement and various issues of the prostate that are associated with elevated DHT that occurs with age. The topical finasterides were designed with the hope that the finasteride would make it into the hair follicle and would inhibit DHT there and allow for more growth of the hair, which apparently it does, but not make it into the systemic circulation, or at least not at concentrations sufficient enough to cause as many side effects as with the oral dosing. Now, the problem is it does make it into systemic circulation. The issue is also that topical application of finasteride is harder to dose than oral finasteride. I'm not saying you should be taking oral rather than topical finasteride, but keep in mind that the dosages of finasteride that have been shown to be effective for inducing hair growth cover an enormous range. So as low as 0.01 milligrams per day and as high as 5 milligrams per day, which is a just staggering range. Now, in trying to simplify the problem of how much finasteride to take, either by way of oral tablet or by way of topical solution, we can get a bit of leverage on this by thinking about how much DHT reduction occurs as a function of dose. And there, finasteride shows this really interesting, what's called logarithmic distribution. What it means is that for a dosage of 0.01 milligrams of finasteride, you're going to achieve approximately 50% reduction in DHT. And that's systemic DHT. So this is a blood draw measuring your DHT, then taking 0.01 milligrams of finasteride. Again, 0.01, very low dose of finasteride.
So I guess the point is that it comes in oral dosing. There's topical dosing of finasteride. The idea is whether or not topical is less systemic absorption, whether there's less risk of side effects. Now, that's possibly true. However, people can get side effects from the oral or the topical version as well. It's important to note that the oral form of finasteride is what is FDA approved, the 1 milligram dosage. The topical form of finasteride is technically what's considered off-label. So that's something to have a discussion with your physician as well. A lot of, pharmacies, if they're going to make a topical finasteride, may combine it with topical minoxidil as well. So you just have to use one product to get both of the medications. So that's important to take note of.
For a period of a couple of weeks, measure people's DHT in their blood again, and you see that it's reduced by 50%. However, at increasing dosages of 0.2 milligrams, 1 milligrams, 5 milligrams of oral finasteride per day over the same period of time, the increase, or I should say the reduction in dihydrotestosterone doesn't increase linearly. It's not that you go from 50% to 60% to 75% to 100% with each increasing dose. It tapers off. It kind of flattens out. It tends to increase a little bit, but it's sort of a gradual slope increasing as you head from 0.2 milligrams out to 5 milligrams. So what this means is that given that reducing DHT can cause various side effects, sexual side effects, reductions in either sexual function or sexual drive, as well as overall drive and motivation, sometimes even some depressive symptoms, that everything points to taking the lowest effective dose of finasteride and starting with a very low dose of finasteride, because low doses of finasteride, even at that 0.01 milligrams taken orally daily, are already leading to a 50% reduction in dihydrotestosterone, and thereby, taken for a long enough period of time, should offset hair loss and stimulate hair growth.
So what he's saying is that if you can give a lower dosage of oral finasteride, you can get a benefit from there for your hair without, maybe trying to avoid some of those potential side effects. And that may be true. But when we prescribe finasteride to your local pharmacy, it comes in a 1 milligram pill. That's the dosing of it. Now, some people can cut it, can take a half a pill, can take it every other day. And people can do that. If they're concerned about potential side effects, they can try to lower the dosage and start there. And if there's benefit, they can continue. Some people start there, then increase it to the 1 milligram as long as they're not having any issues or side effects taking the medication. So that's something that you could talk to your physician about, what may be the best dosage for you. we a lot of times don't know going into it. So a lot of people may just get the prescription for the FDA recommended dosage of 1 milligram, but for a lot of people, taking less than that can be equally as effective. So it's something to have a discussion and to see what may be best for you. Once again, finasteride is an effective medication. It works very well. It's been around a long time. It's been FDA approved for a long time. Whether or not someone has a hair transplant in my practice, I do discuss finasteride with everybody, because if you're not having a hair transplant, you want to keep your hair, you want to help to thicken it, you want to maintain it. If you are having a hair transplant, well, you still want to keep your natural hair. You want to prevent yourself from losing that hair, prevent it from progressing while you are adding more density and coverage from the transplant. So they go hand in hand. Medical, surgical options go hand in hand. But finasteride is important. However, once again, you have to have a discussion about potential side effects from it. Potential side effects that, when you stop it, a lot of times goes away, but some symptoms may persist. So those are important to have a full discussion before you start taking it. So in general, from a medical standpoint, and what I find to be the most effective of the medical treatments for hair loss, and this is a discussion I have every day in my practice, there are the medical treatments that have been around a long time, the finasteride, minoxidil. They work, they're tried, tested, they work. For both of them, there's oral and topical formulations of it. For finasteride, the oral is what's FDA approved, the topical is off-label. For minoxidil, the topical is FDA approved, and the oral is off-label. However, we find that with a lot of patients, both of the formulations can work. So if someone does not want to take pills or does not want to take something that is absorbed systemically as much as a pill would be, there is the topical formulation that is available. Usually the oral versions may be a little bit more effective, especially for the finasteride, but once again, it's important to have a discussion regarding side effects before you start using it. Now, in addition to those two medications, I find PRP, or platelet-rich plasma injections, also can be beneficial in terms of maintaining your hair, helping to reverse the thinning, and helping to thicken up your hair as well. So I think those are the three best treatments, the finasteride, minoxidil, and then PRP for hair loss and hair thickening and to help to maintain your hair. There's other options that I think can complement these treatments, such as vitamin supplements or laser devices or microneedling or dermarolling or other treatments that may help in addition. But those three, the finasteride, minoxidil, PRP, I think are going to be the most effective for someone who wants to maintain their hair and try to thicken their hair as well.